on it. And now I'm recording. All right, fantastic.
All right.
Okay, we're going to take it from the top. Rita, would you like to call to order?
Okay. Hi, everybody. This is May 27, 2020. I am calling to order this meeting of the Animal Care Services Advisory Board. Chase, will you please call roll call?
All right, let's try this again. Michael Shannon.
Here.
All right, fantastic. Cynthia Cox. I do not see Cindy. Martha Banda.
Present.
Thank you. George Garcia. Not see George. Let me check real quick. Nope, I do not see George. Okay, Rita.
Here.
Karen.
Here.
Kathy Davis.
Present.
Val Moore. Don't see Val. Katie Jarl.
Hi, y'all. I'm here.
Thank you, Katie. Susan Belden.
Present.
Thank you. Sally Scott. Do not see Sally. Dr. Gottbetter.
Present.
Thank you, Doc. Heber Lefton. Heber.
I'm here.
Okay, thank you. And David McCary.
Here.
Thank you. Okay, that gives us a total of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It gives us 10 present. Madam Chair, we have a quorum.
Thank you, Chase. The Animal Care Advisory Board is an advisory, it's appointed by City Council. I'm Rita Brodegum and I am chair. It's the function of the board to assist and advise the City of San Antonio regarding animal care services through recommendations, reports, and by representing ACS in the community and with our assigned council districts. Members of the public can watch this meeting through WebEx or listen to the meeting through audio only by calling 415-655-001 and using code 287-082-569. This meeting is being recorded. I'll repeat those numbers for you. Audio only, call 415-655-0001 using access code 287-082-569. Because this is our first web meeting, I've asked ACS staff to provide additional instructions for today's meeting. Chase, will you please give us a statement on what's going to happen here?
All right, happy to. So I'll be reading from the script. If anyone has any questions, just let me know afterwards. I'll keep an eye on you, and we'll go from there. So thanks, Rita. Before we begin, I'd like to quickly thank the board members and ACS staff who've worked to make today's meeting happen. ACS would also like to thank everyone attending today for being patient and understanding during our first video conference meeting. On the call are our board members, as noted by the roll call, Assistant City Manager David McCary, who represents the City Manager for ACS, ACS staff, including Director Heber Lefgren and Assistant Director Shannon Sims, and our Assistant City Attorney, Alma Lozano. My name is Chase Fossey, and I am the department's assistant to the director and today's meeting liaison. I'll start by providing an overview of today's meeting format. We've made a few changes to the meeting procedures to ensure that today's meeting runs smoothly and effectively. We will begin shortly by displaying the list of items to be considered today. We have items that haven't been included on the consent agenda. Board members, we ask that you all keep yourselves muted unless you are speaking. If a board member would like to speak, we ask that they unmute themselves, state their name, and then briefly pause before proceeding. This will make sure we know who is speaking at all times, and also that we're not speaking over one another. Like most video conference platforms, WebEx does have a chat feature. However, we ask that board members refrain from using the chat tool and keep all comments on the spoken record. For each item, staff will start by making a presentation. After the presentation, board members can discuss the item and ask any follow-up questions of staff. After discussion is closed, we will open the floor to motions. We ask that any board member who is making a motion first do so by stating their name, pausing, and then proceeding with the motion. All voting will be done by roll call. When I call your name, please unmute your microphone, indicate your vote, and then remute yourself. We will do this slowly each time so that it's clear. Although not available as part of today's meeting, opportunities for members of the public who have comments or questions are still available. For example, ACS Director Heber Lefkin will be hosting a live Meet the Director event on Facebook tomorrow evening at 4:30 p.m. During tomorrow's Meet the Director event, Heber will provide to the general public a briefing on ACS's response to COVID-19, similar to tonight's briefing, and will also take questions and comments from viewers. Information on how to join this event is available on the ACS website and through the ACS Facebook page. Individuals with questions or comments may also contact the Director of ACS directly through email. Heber's email is heber.lefgren, Heber.Lefgren, Lefgren, at sanantonio.gov. Additional contact information for ACS and members of the ACS Advisory Board is available on the ACS website or can be obtained by calling 207-4-PETS. And with that, we are ready to view the agenda. I'll pull that up. Okay. If someone could give me confirmation that you do see the beginning of the agenda on the screen. Heber?
I see it.
Okay, excellent. Got thumbs up from a few other folks. Okay, let me pull my script back up. Okay, the first 5 items for today's meeting are on the consent agenda. Do any board members have any questions about any consent agenda item or wish to pull any of these items for individual consideration? Please remember to state your name first when you unmute yourself.
Chase,
Yes, sir.
I am so sorry to interrupt the protocol here, but can I make a couple of opening remarks to everyone?
Yeah,
Is that, I didn't know if there was a part in there. Heber and I talked and said I'd be able to say hello to everybody. So is that out of order, Madam Chair, Ms. Rita?
Rita, make sure to unmute yourself. We can't hear you.
We would love to have some opening remarks from you, David. We're so glad you're here.
Thank you. What it is I am excited for this opportunity. Animal care, I have to tell you, I don't remember not having a pet in the home. We did a rescue here almost 13 years ago, a little puppy named Prince Henry, German Schnauzer that was found by Animal Care. And when you looked at him, you couldn't even tell he was a German Schnauzer. And he couldn't have been more than a year old. And Prince Henry is still alive and well and doing strong. And I have to say this, I greatly appreciate and value everyone's passion about our animals and our caring and the adoption and the entire process to not only embrace, but you're talking about an opportunity that just needs to multiply. So as a new assistant city manager who's been paid to talk trash all of his career and getting a chance to engage and be a part of what y'all have been doing. My hat's off to you, and I really would like to validate everything that y'all have done, and let me know where I can help, where I can be a positive influence from the city manager's office. And I'm not going to bore you with any long drawn out speeches or anything like this, but I have to tell you, in my new role since the end of February, I have really been impressed with animal care services. Heber as the director, the entire staff. I've had a chance to tour the facility on more than one occasions, but here recently, just getting that added opportunity. And I just think that the leadership and the commitment is there and it's strong. And I know that is also a reflection of the advisory board. So again, not meaning to bore you, but I just wanted to say hello to each and every one of you. And hopefully we'll get to a place where we'll be able to meet face to face and really see each other and do future projects together. But count me in, tag me in, as they would say in wrestling, and WWF is kind of like, tag me in, and we'll go from there. Chase, thank y'all all for allowing me to just say a couple of words. I greatly appreciate it.
Thank you, David.
Hey, Rita, I'd like to just kind of just jump in if that's all right. So from the perspective of, from my perspective, I will say that I have grown to love and working with Maria during the time that we've had a chance to work with her. I've had a chance to work directly with Eric when he oversaw ACS, with Gloria when she oversaw ACS, with Maria, and now with David. And I can tell you that it definitely is a reflection, in my opinion, of ACS's importance to the city. I've been able to work with David in the past month, and I can tell you that he is a great addition. We will all miss Maria, but we know that she will continue to fight our cause. And so I see this as a pure addition. So David, just for public purposes, you are an outstanding individual, and we are grateful to be able to have you part of the team.
All right. Notice that David is the only one still wearing a tie, so he does have that going for him.
I want y'all to know I wore this tie for all of you. I didn't have one on yesterday, but I wanted to wear one today. Thank you.
All right. So thank you all for that. I'm going to share the agenda again, and I will restart my script. And all right, let's go. So the first 5 meetings first off, did that share correctly? Does everybody see that? Am I getting no? I'm getting no's. Okay, let's try it again.
I don't see it.
Share this one. There we go. Better.
It's there.
Okay. All right. So the first 5 meetings for today's meeting are on the consent agenda. Do any board members have any questions about any consent agenda item, or wish to pull any of these items for individual consideration? Please remember to state your name first when you unmute yourself. While y'all are giving that some thought and consideration, I would like to proactively point out that we did catch a mistake prior to the start of today's meeting on the 3rd consent agenda item, approval of ACS Advisory Board fiscal year 2020 second quarter report. The 6th page of that document was incorrectly carried over from the 1st quarter report. So I would ask that if you consider approving that report, that you do so contingent upon us removing that unnecessary page 6. So with that, I will keep my eye out for anyone who wants to speak and go from there.
Chase, I don't need to pull anything. Everything's fine with me. Karen Spear.
Okay. So I don't need everyone to confirm individually if you're okay with it. I just at this point need individuals to speak up if they do have questions or would like to pull any of these items for consideration? Okay, I'm not seeing anything. So unless I'm missing it, Rita, the floor is yours.
Okay. Thank you, Chase. We are now ready to entertain a motion consent agenda contingent to removing page 6 from the second quarterly report. Is there a member that would be willing to motion?
This is Kathy Davis. I would be willing to move that we accept the consent agenda, items 1 through 5, with as amended to number 3 for page 6.
Thank you, Kathy. Is there a second?
Karen Spear, I second the motion.
Having heard a motion to approve the consent agenda, which has been seconded, can we have a roll call vote, please, Chase?
Yes, I'm going to unshare my screen so I can see a little bit more of the meeting. Give me a second here. Okay, there's my participant list. Scripts. Okay, so I have a motion and a second. I will start with Michael Shannon. Mike?
Yay.
Thank you. Cindy Cox? Still not here. Martha Banda?
Yay.
George Garcia? I believe George is still not here. Rita?
Yay.
Thank you. Karen Spear?
Yay.
Kathleen Davis?
Yay.
Val Moore? Still not here. Katie Jarl?
Yay.
Susan Belden? Sorry, Susan, can you unmute, please?
Yay.
All right, thank you. And Sally Scott? And Sally's still not here. Okay, so 1, 2, 3, 4, 5, 6, 7. 7 A's to 0 nays. The motion passes. All right. Next up on the agenda, and I will share that again. So, next up on the agenda is item 6, individual item for consideration. This is a briefing on ACS's response to COVID-19. Let me pull up the presentation. Share that. They make this look so easy during council meetings. I feel like I need 3 more arms. All right, it is thinking about opening.
Now, Chase, if necessary, I can share it on from my screen.
Okay, it did open, but if you want to, I can try and make you presenter and we can go from there.
Oh, there you go.
You want to try that?
All right. So this item on the agenda is providing you as a board, advisory board, kind of like an update as for where we are, in particular during the COVID-19 response, and what we have been doing over the course of the last few months. I wanted to start off by just going back to 3 months ago, when there was a lot that was unknown, and there still is a lot that is unknown, but kind of put into context as for what was happening at the initial time. At that particular time, again, we did not know what was going to happen. We did not know how severe it was going to be. And so there was a lot of planning for the unknown.
Heber, I'm sorry to interrupt, but you are presenter now. So if you could share your screen of the PowerPoint presentation so that everyone can see.
You bet. Give me one second. All right, is everybody able to see the screen?
Yes, Heber.
So there was a lot of unknowns at the very beginning, and so we were really taking a look and preparing for almost every case and every potential scenario. On the city side was preparing for what would happen if we would see a 40% workload that became unavailable to provide ACS or provide city services. On ACS planning, we were also expecting and planning for the worst case scenario where we would see a decrease in an increase in the demand for services while simultaneously seeing a decrease in the available placement options for those pets on our campus. Now, it was still unknown. In addition to all of that, we were also expecting and planning what would happen if it is discovered that animals become carriers and what will happen for those own pets of hospitalized individuals. How are we able to provide that? So the beginning of this crisis resulted in an initial list of recommendations that we wanted to implement, but also the continual reevaluation of other potential options to be implemented quickly if or when determined essential. From an ACS management standpoint, we were having daily meetings through WebEx with all of the leadership and just brainstorming every potential crisis that could result and how would we deal with that when it would happen. And so I first want to start off by just expressing to the board the impressiveness that the ACS leadership team had. They were continually coming up with new ideas and new what if in case it was necessary. And I cannot emphasize enough the amount of work that went into so that we could be as prepared as possible for nearly every potential possibility. This slide represents kind of like the general COVID preparing principles we had on the city of San Antonio side, where the direction was that we needed to focus on emergency response, basic operations, and then recovery. What that means is on the city side, what can we do to ensure that San Antonio has the resources needed to address the COVID crisis? A perfect example of how ACS played in that is we were asked to reach out to every single animal veterinarian here in San Antonio to identify a list of potential equipment that could, if necessary, be converted into human use if needed. So particularly the respirators. We have the basic operations to be able to redirect during this time of crisis, redirect non-essential resources to support the basic city services during the crisis. And then, of course, to prepare for a way and find a way to recover from the impact of the crisis. That is both operationally and long-term financially. With those key principles, Animal Care Services also had as a major priority of how can we provide the service while simultaneously, first and foremost, protect the ACS staff. The discussions I had with ACS staff continually was how can we make our facility the safest place for our employees outside of his or her own home. That was a topic of continual conversation to make sure that the staff was protected. We also focused on how do we protect the pets by maintaining the continued balanced approach to community services. When the city was asking what is the basic operations and what are the essential services, our take on that and the way that we translated it, it was that we continue to, if field services needed to be and was continued to be an essential service, then finding placement for those pets in one way or another also needed to be identified as an essential service. And which also means that if resources became lower during the crisis, that we needed to be able to have plans that maintain that balanced approach in the services we provided. We also implemented internally as one of our core principles in identifying what we did and what we didn't do was how can we review and reinvent as many processes as possible so that we can maintain as many services as possible. And then finally, to be prepared with strategies to be implemented quickly as situations changed along the way. This list only demonstrates 11 of the largest policies and practice changes that we made here on our campus. It does not, with the exception of one, it does not include those potential changes that we stood ready. These are simply the ones that we implemented in one way or another. And this presentation will briefly and quickly go over each one of these so that you are aware. The first, one of the first changes that we made was to implement an appointment-based service on campus. What that means is instead of just making it available for everybody to come on campus, we needed people to be able to go through a right process to be able to get an appointment and come in so that we can control the flow of people. Bethany did a fabulous job. Bethany and her team did a fabulous job to implement, to quickly implement an online way for customers to be able to schedule an appointment for them to come onto our campus to adopt or to provide any services. In addition, this method also limited the amount of contact because it allowed somebody to come on campus to sit in their car until we were ready to serve them, at which point we are able to send them a quick text through this program to invite them to come up front and provide and meet with the staff member that they needed to speak with. By changing through this automated or this electronic appointment-based service, the reason why we implemented this was, of course, to keep staff and customers safe through social distancing by controlling the number of visitors on campus. Just prior to the implementation, or just prior to the COVID crisis becoming an issue, we had undergone an adoption event where there were lines of people waiting to be adopted. And our greatest fear was that if we did not control the flow of traffic, that we would be obligated to shut our doors, resulting in some negative consequences, particularly that of euthanizing healthy animals. And so this appointment-based service allowed us to be able to stay open. Through this appointment-based services, we've tracked that we've been able to book 4,800 people with adoption interest, and then over 1,000 bookings for intake and other customer service functions. We are still operating through an appointment-based service. Our plan is over the next few months to continue to maintain that system where people are allowed to come onto our campus through an appointment, but slowly increase the number of people allowed on our campus to the level that we are able to control social, or to assist with social distancing. Long term, we hope to be able to get to the point where we can completely reopen the campus for adoptions. However, the change in process has demonstrated the benefit of having a check-in system. And so we are looking to be able to reopen our campus for people who are walking in, but we still want to continue to maintain a check-in process so that we can provide information instantaneously to our customers, as well as collect information from those people visiting our campus. We'd like to be able to, it is our plan to also retain the appointment-based system for owner surrenders, foster hours, pet pickups, and other services provided. Simply because we believe that maintaining that new system will actually increase the customer service provided to our clients. We looked at how we can control the traffic flow on campus. Here's a picture of the front of our annex where we've established the front intake where the greeter, where they are able to come in. You notice that we've put barriers to be able to maintain a 6-foot distance between our staff and those that they interact with. Those barriers are throughout our campus, in the front lobby area, in the annex with our adoption staff. Again, to be able to protect staff as well as those who are on our campus. We've also identified a route for individuals going through our campus, and a simple way to describe it, we have created there is a one-way into a building and a one-way out of a building, very similar to that of IKEA. Here's the route that you are going to go. That way we can make sure that we don't have people interacting or coming in close contact with other individuals. Now, obviously, why did we implement this traffic flow of people? We want to keep staff and visitors safe through social distancing without having to be required to shut our doors. Live release functions continue to remain open and accessible to the public. No ACS employee has developed COVID to this point, as well as we have continued to maintain a live release rate in excess of 90%, where historically that live release rate at this time of year is around 88%. Our next steps is to continue to maintain these traffic control measures and to fine tune the route with the expectation to grow it so that we can have more people on our campus at any particular time. The COVID crisis, I will also tell you, has developed, as we've looked at policies, have developed ideas that as a staff, we are looking at continuing long-term for other reasons. For example, we have identified and seen the benefit of having a greeter station in the annex and to flow all traffic on our campus through the annex. And so long-term, we are looking to be able to retain that greeter station in the annex, retain the traffic controls through more permanent signage and barriers, and as a thinking outside of the box, potentially permanently moving adoptions to the annex. During the COVID situation, our adoption offices were tight. We had a lot of individuals in there. And so for the protection of our staff, we moved them to half of the annex. And it has opened up. We are significantly looking at the possibility of permanently keeping them in that annex and turning that annex into the adoption center. One of the reasons for why we want to do that for a customer service aspect is to really illustrate to the community that we are an adoption agency, as well as to be able to catch the customer when they are coming into the facility versus waiting until after they have explored our campus. Out of necessity of the COVID, we did limit the volunteers on our campus. That's fairly straightforward. We wanted to keep the volunteers and our staff safe and to prevent potential liability issues. As a result, we have not been able to have volunteers do a lot of the essential work that they've done on our campus in the past. However, we did redirect some of that work to at-home projects. Volunteers assisted in creating and in sewing 300 plus cloth masks that we've made available to our staff, but also to customers who come to ACS that do not have them. We've also been able to, through our volunteers, have them create over 2,000 throwaway aprons that are used when we are dealing with the sick or the potentially contagious animals, so that we can help control the spread of disease on our campus. Our next steps is to allow established volunteers to resume to a certain level of on-campus services that require minimal person-to-person interactions, and long-term return to full volunteer operations as determined safe for volunteers. As part of our strategy, we've limited our over-the-counter intake. Again, this is just that intake for those pets who come directly to our facility. While we had plans prepared to limit our field intake and our field services, there never came a need for us to implement those. And so we continue to provide field-related services to the community. But in regards to the over-the-counter intake, we did limit those services to only those pets that had essential medical need, as well as we took, when it was convenient and beneficial for us, we also did limited owner surrender intake. A perfect example, we had a national organization that funded an adoption event, and we needed pets, surprisingly. And so we reached out to a lot of these individuals who had previously indicated that they wanted to owner surrender their pets, and we coordinated them, bringing them to ACS so that we can find placement for those. Obviously, why did we do this? Is to direct the attention to and prepare to provide essential ACS services by preparing for an expected increase in field intake and a decrease in positive placement. We wanted to continue to maintain that balanced approach between the services that we are provided and to be able to keep live release placement as a priority. What resulted is that ACS was able to maintain a balanced approach, and that over the course of the last 2 months or during this crisis, ACS has not had a need to euthanize any animals for space, which is historic, which is unprecedented in ACS's history. Our next steps, we are slowly reopening over-the-counter intake through appointment basis only, and we will continue to use online live release messaging system. If you go to the ACS's website or to ACS's Facebook, there's an opportunity for individuals to ask questions, and we have staff who are able to answer those questions live when staff is available. This allows us to be able to answer a lot of questions and to be able to provide resources to individuals on what they can do with the pets that they need to find placement. Now, long-term, as we look nationwide of the changes that are happening in animal care services and here at ACS, we are looking at making some long-term changes to the services we provide over the counter. In particularly, we are looking at only providing the over-the-counter services through an appointment system for owner surrenders or for emergency situations. We are looking at piloting a program where we are going to continue to direct stray over-the-counter impoundments through 311 and invite field and have field go and respond to those service requests, or by providing the existing or a new diversion program to the customers. One of the things that we are looking at as a board, if you recall, a few years ago, we made some changes to the Axillamar report where we are showing individuals the number of pets that are being diverted from our shelter. But down in the bottom, we created another category called diversion PPO. It's on the Axillamar report, but you will notice that there has never been a number associated with that, because while we know what the diversion PPO program is, we currently do not have the resources to manage it. The diversion PPO program is where backyard rescuers or individuals who find stray animals on the street and want to find on their own placement for those pets that they have the opportunity to provide us the information so that we can put it into the system and gain official ownership of the animal so that we can then transfer the ownership to those either rescue groups or to the community members who are striving to help, so that they are not in any that they do not have any liability issues, as well as so that we can, as a city, report and track the good work that many people do in the community to help ACS. We have not been able to start that program due to the need for resources to manage it and maintain it. By making these changes through our over-the-counter process, we believe that we are able to, we'll be able to have the resources to really get that program up and going, and to be able to find new placement options for pets without them even having to come to the ACS shelter. Out of necessity, we stopped providing our spay and neuter surgeries on campus and converted to a voucher program where we provide adopters a voucher where they can take the pets to be spayed or neutered free of charge or at no cost to the adopters. The reason and the requirement to provide this voucher-based program is due to the inability to find a way at the time to perform high quantity of surgeries while maintaining a safe social distancing for our staff. To date, we have seen over 570 vouchers have been issued to either adopters or rescue organizations, and we will continue to monitor that. Our next steps is to slowly reintroduce surgeries into our system beginning in June, where we will start with doing surgeries 2 days away with changes in policies and procedures. And over time, we will ramp up the number of surgeries and the number of surgery days as demand and is necessary, as well as we feel confident that we can maintain a safe environment for our employees. Long term, we will need to continue to ensure and perform follow-up on those pets that we've given vouchers to ensure that they were actually sterilized. We have a list of those pets that left our shelter unsterilized, and we have the ability to be able to track them. And so that will be on a long-term, something that we will need to do to make sure that the surgeries took place. This crisis has also demonstrated a need to be able to split the function and the location of where we are providing medical care for the injured animals or to provide the hospitalized services, and split that away from the locations where we are providing spay and neuter surgeries. If you go into our existing clinic today, or when we were operating under normal circumstances, it was a beehive of activity in close proximity. One of the ideas that staff is working on right now is splitting the medical staff and having the care and treatment of the hospitalized animals in one location and maintaining the surgeries in another. One option we are looking at is to convert the existing cattery into either the hospital or the surgery suite, and to find a different location for the cats. That could include moving the cats permanently or more permanently into the annex, or into what has been historically been known as the puppy room or the adoption center. That way they are away from other animals, but yet accessible to the general public. More information will be made available to you as we vet out those ideas, but long term, that is one of the ideas that we have that we believe will have multiple benefits for the organization outside of just precautionary COVID-19 measures. During the COVID, we did place a pause on the community cat program. These are the programs this is the program where we issue traps out to members of the public to trap feral cats and to bring them to our facility where we spay or neuter them, and then those community members will return those feral cats back to the community permanently altered. We felt a need at that particular time to temporarily discontinue those services due to the many close proximity the hands-on treatment processes that threaten the safety of ACS, as well as we recognize that there was a large percentage of at-risk community members who were participating in that program, and we wanted to protect those individuals as well. As a result, we do understand that there are about 900 surgeries that would have taken place during this time that did not take place. Our next steps is right now we are improving the internal administrative functions of the program to help streamline it. And then our plan is to slowly reinstate the program once we have fully ramped up the ACS in-house surgeries. Our long-term strategy is to return to previous performance levels of this program. Fosters, in preparation, we added resources to increase our foster capability and our marketing. I redirected a lot of the previous marketing resources to our fosters to be able to find more fosters, as well as we had national organizations who were assisting us with that. The reason for this added focus on fosters was to be able to create new opportunities, as well as to provide additional insurance against potential capacity concerns associated with COVID-19. Results, we have seen over 300 new foster participants since March 15th. I'd like to emphasize that this is 300 new foster participants. It does not take into account our previously established foster parents. For context, we normally would have recruited about 40 to 60 new foster participants over that same period of time. Our next steps is to continue to provide additional promotions of the program and to be able to seek assistance from the community through an appointment-based system indefinitely. Long term, we are looking to be able to redirect a portion of our intake resources, as previously explained, to help promote ACS fostering directly from the field through our existing and new diversion program. Part of the process, we implemented a curbside pickup for all animals. Through that intake or through the registration or appointment-based system that I previously shared with you, it has the ability for a customer to indicate when they are on our campus and for us to tell them through text when they are able to pull in and when we are ready for them. Utilizing that system, we are able to first schedule an appointment for individuals who have previously adopted an animal but need to pick the animal up. We have the system to where we can text them, pull them forward, and we bring the dog to them. This, by implementing this change, we were able to keep staff safe by transferring the adopted, fostered, or returned pets to the client without the client having to step foot onto ACS facility. It also allowed us in the control of traffic by ensuring that the people on our campus were looking for pets, not necessarily waiting for a pet to be given to them. Approximately a little over 1,500 animals were picked up through curbside since this process began in mid-March. It is our expectation to continue to provide curbside services as frequently as possible. And on a long term, I currently do not see any reason for why we should not continue to provide that service, even after the crisis is over. We worked with, during this period of time, Shannon did a lot of work. Shannon and Dr. Gottbetter did a lot of work to work with the state to make some changes on how we are quarantining pets that need to be quarantined for rabies exposure. Currently, the state law requires that any dog that is found free of restraint or does not have a current rabies vaccination is required to be quarantined at a certified quarantine facility. They cannot do home quarantine. We work with the state to get permission during this period of time to allow home quarantine, to expand the allowance of home quarantine. ACS policy still requires ACS quarantine for any severe bite in order for us to be able to make sure that the community remains safe. But for non-severe bites that may have occurred while the dog was unrestrained, or if the owner did not have an active rabies vaccination, we established a protocol where the field officer initially takes a video of the dog, posts it on an internal system for a veterinarian to evaluate that dog's behavior and to begin the quarantine process electronically. At the end of the quarantine period, another video of that dog is provided electronically to our vet, where our vets evaluate the dog, ensures that there are no signs of rabies, and then clears the dog from being quarantined. Obviously, the reason for why we did this was, one, to be able to maximize the social distancing while still providing the legal and public safety responsibilities, but also in preparation for the potential need of needing additional space on our campus for other issues. To date, over 280 cases have been processed remotely through this procedure. And our next steps is we will continue to utilize this modified version as long as the state of Texas will allow us to do so. On a long term, we have come to love this process, particularly for those non-threatening bites non-threatening bites. We love this new process. And so on a long-term strategy, we would like to work with both the city as well as other city agencies to propose future state legislative changes that would allow ACS to continue this process in the future. This item of reduced hours of operation is a recommendation that we had in our back pocket in case there would ever come a point in time where our staffing levels would require it. The proposal was to shift our weekly daily hours of operations from 11 o'clock to 7 o'clock and simply change it from the hours of public operations to 1 o'clock to 7 o'clock. The proposal was intended by reducing the hours of public operations. What that meant was that we could take our staff that currently are on 2 shifts and condense them down into 1 shift of 1 group of individuals who start the day on at the same time and end the day at the end of our business. It was a strategy that we had in place, but as we continue to develop that strategy, while we did not implement that, I'd like to share with the board that we are strongly considering a pilot program going forward where we reduce the hours of operation. The intent of the reduction of the hours of operation is because we see potential increases in customer service through it. Right, for an example, right now, my shelter staff, I have a shelter staff, 1 team that comes in early in the morning to prepare for, to get the facility cleaned and operating before the community comes in. But that shift of people, they go home at 5 o'clock. And then the second shift of half of our staff are then operating between the hours of 5 o'clock and 7 o'clock. If we were to shift our hours of operation and changed the opening hours during the weekdays from 11 o'clock to 1 o'clock. In our conversations with the customers who come in at 11 o'clock, their schedule is flexible enough that they can also come in at 1 o'clock if we were to open up at that time. But by having one shift and everybody working during the day, it means that during the hours of 5 o'clock and 7 o'clock, the number of employees that are on our campus to provide customer service doubles without having to request additional staffing level. And so what our next steps is to pilot test over the few months the reduction of hours in the public to see if there is a visibly noticeable level of service delivery without a decrease in live placement. If the pilot is successful, it is our plan long terms to implement those changes long term. And obviously, if the pilot is not successful, we will return to previous hours of operation. This slide represents some internal preventative measures that have been implemented by either the City of San Antonio or ACS that is not seen by the general public, but is seen daily by ACS staff. So you are aware, every staff member every day will come into our facility and have a temperature check and review a set of questions to ensure that they are not seeing any symptoms of COVID-19. That also applies to every visitor who comes to our campus. During the COVID system, the city implemented travel restrictions for staff that prevented employees from going to outside of their county or their home county without being quarantined afterwards. We've also increased the number of meetings WebEx. It has been over nearly 3 months since I have been able to sit down with my leadership team in a single room to review and policies, practices, and to have a conversation. And of course, we work closely with HR to require quarantining of any sick or potentially sick staff member. In addition to those changes from the city, ACS also has reconfigured our office space and break room to ensure for social distancing. We've increased the amount of sanitation practices for high traffic surfaces to include the vehicles. Every vehicle undergoes a detailed sanitation process now at the beginning of the day and at the beginning of the shift, as well as at the end of the shift. COVID safety kits have been provided to field personnel in case or in those situations where they come across potential customers that need our services but have been identified as COVID patients. In addition, we have spread the use of masks and face covers for all employees when they are, for every situation when they are not alone in their office. So with that kind of gives a brief overview of a lot of the changes. I will once again emphasize the work that staff has performed over these last few months and how they continue to be ready to make changes as needed or as the circumstances require. And so with that, I will turn it over to any questions that anybody may have in regards to the operations over the last few months.
All right. While everyone is thinking about their questions that they may want to ask, I would like to welcome Sally Scott, who I saw got a chance to join the meeting during Heber's presentation. So welcome, Sally. And Sally,
Welcome, Sally.
Just so you know, you are on mute right now. All board members are encouraged to be muted when they're not actively talking, just to keep down on the noise levels. So somewhere on your screen should be a button to unmute yourself if at some point during the meeting you would like to talk. So with that, Yeah, any questions for Heber on that presentation?
This is Kathy Davis. I don't have any questions, but I just wanted to reconfirm what you said, Heber, that there has been no ACS employee that has tested positive for COVID-19. Is that correct?
That is correct.
And to compliment you on the 300 new foster parents, that is just phenomenal. I would have never thought we could get to that number. So my deep, sincere congrats to your staff for managing to get to that number. It's kind of the silver lining underneath this dark cloud we've all been under.
Over the last few months, I've had a lot of conversations with a lot of directors throughout the entire United States. And I will tell you that with everything, with all the concerns, I will say that this has definitely has demonstrated the good that people play when it comes to their pets, that there has been added focus, added attention. And if we can find some way to harness that and keep that going, we will all be able to start focusing on those issues and those animal related concerns that we want to focus on, because the things that are mandatory that we don't need to, but we have to, are being taken care of themselves.
Just a great job, Heber. Thank you.
Rita Brodegum Heber. I just want to congratulate the ACS leadership setting up these parameters that have kept staff and the community safe while, all the while saving all the lives that you did. It's just, you did an incredible job. And I speak, I'm sure, for the whole board that we're all very proud of the job that ACS staff is doing to control, any sickness in the facility.
Heber, this is Sally. I hope that many of those people will adopt their foster.
So my understanding historically, the longer a foster retains a fostered animal, the higher the percentage and the higher the possibility for them to adopt occurs. So I am right there with you, Sally.
As a 7-time failed foster, I guarantee you most of those are staying home.
Agreed.
All right, any other questions or comments before we move on to the next presentation? Well, going once, going twice. Okay, I guess that means I am up. So the next item on our agenda, I'm going to reclaim presenter, Heber, and share my screen. All right, can everybody see that?
Yes.
All right, getting a thumbs up. Excellent.
Yes.
So the next item, I'm going to provide an overview of the results from the pet sales survey that occurred in February of 2020. If this presentation is already giving you a sense of deja vu, that's because it is exceptionally similar to a presentation that you all received on this topic earlier from a survey that was conducted in July of last year. So to provide a little bit of background, in fiscal year 2019, during the budget presentation, ACS indicated that we would be investigating whether we could prohibit the sale of dogs in stores. That effort came about based on recommendations from the Humane Society of the United States, as well as research that we conducted on best practices from other locations. So we found 280 plus cities around the United States, including entire states that had either banned or put some restrictions on the practice of selling pets for profit in pet stores. So as we began to engage on this issue, and just as a reminder, the city does have new SA Speak Up guidelines that were established in February of 2019. And this essentially makes sure that any city department that seeks public input on issues goes through 4 stages. That they engage with the community, publish a they review the findings from the engagement, they publish a report on those findings, and then they implement what they found. So in July of last year, we conducted an initial survey that really was designed to take the temperature of the community on whether or not pet sales in stores was something that the community was interested in us pursuing, and if so, what direction they wanted us to take that. That initial survey was open from July 1st to July 31st of 2019 and was conducted or advertised among many different channels. And in that initial survey, we did garner a little over 3,000 responses, which brings me to the February pet sales survey, which was conducted earlier this year. This survey, instead of just trying to take the public's temperature on this issue, was designed to gather feedback on very specific ordinance proposals. So we had gone from, what does the community think about this to, okay, what does the community think about this very particular ordinance change? This survey was open from February 14th to March 16th of this year, just before COVID really started affecting a lot of our operations here. We did advertise it among the same channels, and we did garner a little over 1,000 responses. While the number of responses was lower, we did put an extra emphasis during this survey on trying to gather a more equal distribution of responses from council districts. So what you're seeing here is the green line is the first survey. You'll see kind of more peaks and valleys there. It's a more jagged line, whereas what we were able to accomplish with the second survey is much more flat. So we were able to achieve a more equal representation across council districts, which is something that we felt was very important. If we're going to pursue and propose ordinance changes, we want to make sure that we're hearing from all of our council districts to the fullest extent possible. So I do want to briefly take you through the results that we found from the 9 specific questions that we asked. First, minimum fines should be raised from $100 to at least $500 for all individuals convicted of pet sale violations in San Antonio. Not much of a story between districts, overwhelming support across the board, and that is a consistent theme that we'll see throughout these survey results. Question 2, pet shops should not sell a dog or cat unless the dog or cat was obtained from an animal shelter. So this specific ordinance proposal is getting at supply side restrictions for pet shops, making sure that pet shops are not going to sell an animal unless it came from an animal shelter. Again, overwhelming support. But we did ask additional questions on additional sources of animals, including the pet shops should not sell a dog or cat unless the dog or cat was obtained from an animal control agency. We also asked about animal rescue organizations. And in all of those cases, overwhelming support. So moving forward, our recommendation for the final ordinance change language would be to continue to allow pet sales so long as the pets being sold did come from an animal shelter, an animal control agency, or a animal rescue organization. Additionally, we did take a look at some additional restrictions. Pet shops should be required to issue a written statement to the purchaser indicating where the dog or cat they are selling was acquired from. Again, if we're going to put source restrictions in place, it makes sense that there is some sort of transparency around the source of those animals. Again, overwhelming support for that resolution. Pet shops should be required to issue a document to the purchaser verifying the animal is microchipped. Again, overwhelming support. Pet shops should be required to issue a bill of good health to the purchaser, verifying the animal is free of common internal parasites or has been recently treated. It looks a bit more mixed there, but what we see is more agree than strongly agree. But you'll notice that the share of respondents that neither agree nor disagree or disagree is still relatively small. Question 8, we asked pet shops should be required to issue a bill of good health to the purchaser verifying the animal is immunized against common diseases. Very supported measure there. And then finally, pet shops should be required to recommend that the purchaser take their pet for a visit to a veterinarian promptly after purchase. Overwhelming support. So, where does that leave us? The review of the results, I don't think it's unfair to characterize this as overwhelming support for these specific ordinance changes that we did ask about. And then we did not find any significant differences between any of the council districts. So moving forward, we are prepared as a department to take these pieces of feedback that we've gathered from the community forward through the legislative process. In February, we did conduct this second survey, and in March, did have the results analyzed and prepared recommendations. I'll note that we were originally scheduled to have our most recent board meeting in March, and this presentation was prepared for that March meeting. According to the original time frame, we were set in late March to take our findings and recommendations to the Community Health and Equity Subcommittee of City Council. That committee meeting was canceled, postponed to a future date. That date is unknown at this point, but City Council does traditionally take a break during July. So unless the meeting does get scheduled rather quickly for June and we're able to get onto that agenda, it's not likely that we would be able to present these findings or recommendations until potentially August. And then depending on when we are able to get in front of the Community Health and Equity Subcommittee and get their approval to move forward, approximately 1 month after that briefing is when we would be able to propose the actual ordinance changes to the full City Council at an A session. So that was pretty quick. Again, different questions than what we answered before. It was a different purpose, but similar results to what we saw in the first survey in terms of general overwhelming public support for the direction that ACS is pursuing at this point. So with that, I will stop sharing my screen and ask if we have any questions or comments.
This is Sally. Did you get wording from other cities?
I'm sorry, Sally, I didn't catch that. Did you say wording?
Yes.
Yes, we did actually. 2 Texas cities in particular have implemented pet shop restrictions. I guess it's fair to say pet shop restrictions, the sale of dogs and cats within pet shops, Austin and El Paso. And because those 2 large Texas cities had already implemented language within the legal framework of Texas, we predominantly based a lot of our specific language off of what those 2 cities had implemented. But yes, this was not something that we wanted to be pioneers in. Instead, follow the already tested example that had been put in place by some other Texas cities.
Okay.
David, I saw you raised your hand.
Yeah, I just wanted to ask on the comparison chart that you gave, there were, seems like the second year there was more of a balance you had indicated. did y'all do something different the second year in prepping to create that balance, or did your survey kind of what caused the balance? Because that was interesting for
Yeah,
me.
the balance between city council districts. Yeah.
Yes. Was there a
So-
different outreach strategy? Any kind of
Yeah, so we
campaign
did. We
done?
did have a slightly different outreach strategy. Two things immediately come to mind, and I'll be happy to circle back with our marketing team and get you all, specific strategies that were employed. But the two things that jump out to me straight off the bat, one, this survey was conducted and wrapped up just before COVID started affecting our operations here. So back in the olden days when people had physical gatherings and what used to be called events out in council districts, our marketing team did make a point to target their boots on the ground approach to any events that were already occurring within those particular council districts. So a lot of it was just good old fashioned boots on the ground. We did also have some marketing dollars allocated in support of this survey and getting the word out. And through some of the wizardry of Facebook advertisements, we were able to target advertisements, particularly at the geographic areas that were underrepresented last time. So we could try and boost the amount of responses from some of those council districts that had previously lagged, while at the same time not trying to overly push on council districts that were overrepresented last time. So I think that's how we achieved some of that equilibrium.
So David, this is
That was well
this is
done.
Heber. I want to also just tag on from a policy direction and the direction, or that second one. The first one was focused on let's see how many responses we can get. Let's get as broad as we possibly can and just see what people are saying. When we went into the second one, the instruction specifically was let's get a balanced approach. That the balanced approach was more of a priority than the quantity. And so that meant that the education team, as they were managing that process, they were continually looking at the results, identifying where the results were coming at, and pivoting the way their marketing and the way they were doing so that they could get a more balanced approach.
Thank you, sir.
Kathy Davis, not obviously we don't have access to the language of the proposed ordinance, but my concern would be just hearing what was in this presentation. Is there something in the proposed ordinance language that would prohibit a puppy mill breeder in Missouri who decided to now call themselves a rescue group from continuing to sell to a pet store here in San Antonio?
Yeah, so that's one of the, that is interesting. That was one of the, you hit on one of two sticking points that we have had a lot of discussion on recently. One of the things that my team has been working closely with Alma on, particularly on that point, is how do we make sure that this thing is airtight? And I think the last thing anybody wants is to go through this process, put in place new ordinance changes, and then have the very embarrassing realization that, oops, there's a big loophole here. So our current draft is to not just say, as we did in the survey, that it has to come from a, quote, animal rescue group, but that instead it's an animal rescue group registered with the city. So our intention behind that is not to go through some sort of necessarily rigorous review and registration process for rescue groups, but to give us the ability to, before any organization wants to supply pets to pet stores for sale, gives us an opportunity to step in and essentially approve those sources of animals. Is this a bona fide rescue at the discretion of the director? And if we, find that there are puppy mills masquerading as rescue groups or middlemen or things like that, then as part of the rescue group registration or licensing process, we would have the ability to inspect facilities, do whatever it takes to make sure that these rescue groups are operating as true rescue groups. So very much on our radar as we continue to move this forward.
Thanks, I appreciate that, Chase.
The other thing, since I mentioned that there was 2 issues, the other thing that we're just trying to make sure that we have buttoned down is, as you all know, we do have an existing regulatory framework in place for, I don't know what you call them, backyard breeders, just pet sales in general. There have been pet sales ordinances on the books for quite some time. And as part of that existing process that has been in place, in order to sell animals, you need a seller's permit. So what we're essentially doing here is drawing a line between a pet shop license and a seller's permit. So a seller's permit would be targeted at an individual or household who has a litter, not as part of a business model, but it happens, the animals are there and they want to sell those. Then the seller's permit would be designed to essentially allow perhaps 1 litter per year per address, something along those lines. What we want to make sure is that a bona fide pet shop is not able to instead just chain together seller's permits and get animals from wherever they want. So again, we want to make sure that what we push forward, again, working closely with Alma and legal, has any potential loophole that we can identify ironed out before we proceed forward.
Chase, this is Katie.
Yes, ma'am.
Yeah, sorry, I've tried to beep in a few times, but every time I have my dogs, I've decided that's the time to bark. So it wouldn't be an ACS meeting if there wasn't a few barking dogs. But I just first wanted to say thank you so much to you and to Heber and to the whole team for pulling together this information. It's been an incredible thing to watch how you all have been so thorough in going through this process and been very exciting. And I just wanted to say that it's been also really positive news to hear that since we've been talking about this, at least 3 other cities in Texas have taken action to put this ordinance in place. And so I think we're really building some momentum to focus in on some of these really bad actors in Texas. And I just wanted to congratulate you all on all your work. So thank you.
Thank you, Katie. Any other questions or comments? And unless my eyes deceive me, I think I see Val Moore has joined us. There she is waving. Val, you're on mute, so if you do want to weigh in, you'll need to find the a button on your screen to unmute yourself. All right, and you don't have to weigh in, but I can see you talking. There you go.
Is that better? Okay, sorry.
Better.
Hello, everybody. I hope everybody's well.
Hello, Val. Val, any questions or comments?
No, apologies. I sent an email. Alyssa was trying to set me up. My work schedule changed, so I was able to be here tonight. So I just got off the phone with her to try to set all this up. So thank you for your patience.
Well, thank you for your patience as well. I know you and Sally got put through the ringer trying to join us here today. So thank you.
It's no problem. I mean, things happen.
Val, we're glad you're here.
Thank you very much. I appreciate that, Heber.
All right. So any other questions or comments? Otherwise, we can take a look at the next item on the agenda. Okay, not seeing any. Our 8th and final agenda item for this evening is a discussion of ad hoc committees for ACS Advisory Board matters.
Yes.
So I do have one slide that I can bring up. Rita, my understanding is you've got some topics to discuss, but I'm going to try and display this while you're talking, and then we can go from
While I'm talking, okay. I just want to point
So,
out to
sorry,
the board
Val,
members.
this is Heber. Before you begin, Chase, if I understand it correctly, due to the discussions we had, there's a part of Rita's presentation, or part of the presentation, that Rita will basically ask that I share with the board, so that the board can visibly see it in that portion.
Okay. All right. So I'm just standing by. Just
Okay.
you let me know when you're ready for me to put some stuff up on the screen.
Okay, sounds good. Okay, thank you. Board bylaws authorize the creation of ad hoc committees by the executive committee, and then it's ratified by the board through a majority vote. So in response to the discussions that we held in February at our board retreat, the executive committee is proposing the creation of the following ACS board ad hoc committees. So instead of me reading this to you, Heber, I believe you have a slide that you can and describe the what we're proposing for ad hoc committees. So if you could do that now, I'd appreciate it.
In consultation with the attorney's office, with me being staff, I can present something without my face being present as I speak. But as a member of the advisory board, Rita does not have board members who are speaking during a meeting need to be visible to all who are present. And so I am taking a moment so that you as a committee are able to visually see the 6 ad hoc committees that the executive board is creating, as well as for those who are watching this meeting are able to see it. And so I'll just take a moment to walk through them because I can do so while you are seeing it. And then at that point, Rita will finish her presentation. So these are the 6 ad hoc committees that the executive committee is proposing to create, made up of members of the committee. The first one is a facility inspection checklist committee. So this would be a committee of representing that provides recommendations to the board on updates to the current facility inspection checklist. It has been a few years since the board has reviewed and updated that checklist. And so this is a perfect time to be able to evaluate that again. The second ad hoc committee will be the reporting committee. This is a group of committee members who would like to review and make recommendations on what information is presented to the ACS advisory board and is made available to the general public. The third one is the member orientation committee. The member orientation committee is the purpose of that committee would be to make recommended updates to the current board orientation binder. So each of you have that binder that ACS has created that has a lot of useful information. This ad hoc committee would evaluate that binder and make recommended changes that you believe would be beneficial for you in your role as an advisory board member. The fourth would be a position statement committee. The advisory board has an official position statement that was last updated in 2012. And so this ad hoc committee would take some time to provide recommended changes and to update that the board's position statement. The fifth is a mission state engagement committee that of a group of individuals, a group of board members that will assist ACS in developing a strategy to collect residential feedback on a revised ACS mission statement. For reference, Animal Care Services' current mission statement is the same mission statement that we had when I started ACS 9 years ago. And I believe it has been around for quite a while. We understand that we are a different organization, and so our mission statement should be updated. But as we provide an update to that, we want to make sure that we understand what the community members need the ACS to provide for them. And then the sixth ad hoc committee would be the Continuing Education Committee. We understand that there are topics that the board members have questions on or concerns, or even ACS policies that would like to be discussed in greater detail. This committee would work to identify what are those policies or procedures that need to be presented and need to be clarified, as well as identify what is a good way to present those or to have the discussions with either ACS as part of the board. Some of the recent ones is I know a few of you have expressed concerns about ACS's or questions about ACS's picture policy. This committee would be designed to be able to identify what policies to discuss and how those questions can be answered for committee members. With that, I'll turn it back over to Rita.
When I arrived at on the board, the first time I was on the board, there was no inspection checklist. I made the first one. We also didn't have any position statements, and I researched that and wrote those.
Yeah, both of those are essential to today's operations, but we want to make sure that they continue to be relevant.
But the checklist really needs to be in conjunction with the employees at ACS.
That is correct. And so as Rita works with hers, the executive board, as they identified these potential ad hoc committees, they've also identified a way to be able to structure these committees that allows good communication between ACS and the advisory board. Now, keep in mind, and I'm going to take a moment here and just brag on the executive committee that the executive committee has done a lot of work in the last couple of months to take the discussions that we had during the board retreat and find new ways of incorporating those thoughts and ideas into how the board can fulfill its obligations and requirements, and to be able to implement those suggestions that the board made during the retreat. And so that's where the executive board, that's what the executive board used when they created this. Again, I'm not, as a director, I'm not going to take any credit for the creation of these ad hoc committees, even though that as a director, I fully support them and see how I, as a director, can benefit and in my operations by having these. But I give the full credit to the executive board and the work that they have done to be able to synthesize the discussions that we had during the retreat and find ways to implement those things in that the board members requested through the subcommittees. And so at this point, again, I am just sharing these right now so that viewers can visually see it, even though that this was designed through the executive committee. And so at this point, I'll turn the time back to Rita, who will talk. I believe she's going to talk more about the structure. But we don't need to see this presentation as part of that.
Okay, so you get to see my face instead. So here I am. So after retreat, it was clearly identified by the executive committee that members wanted the opportunities to be engaged in the work of the board. the executive committee believes that the creation of these 6 ad hoc committees will provide more opportunities for everyone to be more engaged and more knowledgeable. So let me talk a little bit about the proposed plan here. It's proposed that each of these ad hoc committees contain 3 to 5 members, and that there will be one chair, that advisory board member that will be appointed by the executive committee. Each ad hoc committee, the advisory board chair will appoint of the advisory executive committee members, and Heber will appoint one member of his leadership team. So what you're going to have is 3 to 5 members that choose one of the ad hoc committees that they want to be on. There'll be a chair of that group of 3 to 5. I will appoint at least one member of the executive committee to be on that ad hoc committee, and one person of his leadership. The reason we're having me put one person from the executive committee and Heber one from the leadership team is those 2 people then will be able to be a resource to the ad hoc committee and help with communication between ad hoc, ACS, and the advisory board. So that's the purpose of putting those 2 additional people on. All ad hoc committee members will be determined, approved, and appointed by the executive committee after we receive your requests for participation. So there'll be a way for all of you to decide what committee you want to sit in and what committee you want to spend time just working with a group. It's proposed each appointed ad hoc committee chair will work with the other appointed members to determine the frequency, the time, the location of that individual ad hoc committee. So the people that are on that particular ad hoc committee, they're going to be the ones. You will decide how much time, when you meet. I see it, and the executive committee seems, we're assuming that the meetings are likely going to be to occur maybe approximately once a month with individual assignments in between. As a reminder, before we start these ad hoc committees, because these are working committee meetings, it will not be required that these meetings will be viewable to the public. However, since they may not be viewed to the public, no official advisory board business can be conducted when the ad hoc committee members meet. So you just need to stick with the committee discussing what the that particular to discuss. Let's see, ad hoc committee chairs will the board to determine how frequently they will update the advisory board or seek approval for recommendations during future advisory board meetings. So you're going to get to a point on your ad hoc committee that you're going to come to a point where you want to bring it to the advisory board because you have recommendations that you would like to meet. So that will also we'll set up a time. You will just go to the executive committee, say our ad hoc committee has met, we have these recommendations, we would like to bring it to the board, or we have finished our discussion on our particular committee and we would like to present it to the board. So there'll be a way of you coming together as a small group and then presenting your findings and your recommendations to the board as a whole. What we're going to do is the executive committee is going to come back and meet again in the coming weeks to make these ad hoc committee assignments. Here's what we're going to do. In preparation for that meeting, we're going to send out a formal email to each of you. We're going to ask a few questions. How many ad hoc committees are you able or want to participate in? The second thing we're going to ask is in order of your personal preference, your first being the most important to you, which of the proposed 6 ad hoc committees would you like to work with? Third, Question, are you willing or able to serve as one of the ad hoc committee chairs? If yes, which committee are you willing to chair? So we're going to gather this information and then basically just, form these committees based on what the board members want to participate in. It is recommended that each board member participate in at least 2 ad hoc committees of their choice. However, board members may participate in as many ad hoc committees as you have the time for. I ask that once we send the email that you get it back to us as soon as possible, because that way we can set up these ad hoc committees and start working on the identified things. For today's meeting, we're asking that the board ratify the creation of the 6 ad hoc committees and their proposed structure. Anybody have any questions on these, what I presented here?
Rita, this is Kathy Davis. Just an observation, or I guess a question. Is it expected that some of these committees, for instance, the facility inspection checklist, that to me appears to be a rather short-term project that would be reviewed, recommendations will be made, it'll be brought before the full board, and then that committee is pretty much done, correct?
Correct, yes. That's why we're asking people to choose at least 2 that they want to be on. And if one of the, if you happen to choose the facility checklist, you may want to say that you'll be on 3 committees, that you have the time. It really is based on what people have the time for and the interest in. I think we came up with the 6 committees here based on our discussions at the retreat. Because these were all things that actually we started on our big whiteboards and started sticking stickies all over the place with ideas that we had. But we want to get a group together to solidify those ideas and then bring recommendations to the full board.
Thank you.
Okay, any other questions?
Hi, this is David. Can I take a look one more time at the 6 committees? I was just, maybe Chase, somebody can.
Yeah, I think
Yep,
Heber,
absolutely.
do you have
Heber
those?
had it. I didn't know who was driving the.
Yeah.
That would be me. Give me just a second here.
Now, also, Chase, did we end up sending out the email to the board members that have that list?
No, but I could do that right now. I could just share this. I'll actually save it as a PDF.
I wanted to try to understand position statement committee, the one that's kind of being brought back to life since 2012.
No, it isn't just one statement. It was position statements
Okay.
on different topics like spay, neuter,
Okay.
you look at the national groups to see what theirs is and then modify it to what you think.
Okay. Thank you, Sally. That's what I was just.
Cheryl
Yeah.
Scully had asked for that.
Okay.
Thanks,
That
Sally.
answered my question. Thank you.
Okay, great, thank you. Any other questions that you might have for me on these proposed ad hoc committees? Nope, okay. So I think at this point, we can go then to, if the board doesn't have any more questions, I would like to propose that we make a motion to create the 6 ad hoc committee meetings discussed today, be approved by the advisory board in the manner described. Is anybody willing to make a motion to, at this time, to accept this proposal?
I'll make a motion to accept.
This
Thanks,
is
Val.
Kathy Davis. I'll second.
Kathy, second. Thank you. Having heard a motion and a second, Can we please do a roll call, Chase?
We can. Give me just a second.
Thank you.
Okay. I believe Michael Shannon stepped out, but just in case he's still here, Michael Shannon.
Just as a comment from Michael Shannon, he had to leave suddenly. He texted me that his children's dog had a play date with a skunk.
Oh, no.
Not sure how it ended, but they're panicking and he had to leave. So I wanted the board to know that.
You know, David,
dog-
it's interesting.
Win.
In any other sort of situation, that would be an abnormal occurrence. But for us, I think we all understand.
Fields smelled like skunk today.
Can we send him some tomato juice?
All right. So I'm going to go back into roll call vote
Doesn't get it.
in support of the motion in the second. Michael Shannon is not here. Cindy Cox, I believe she's here. Martha Banda.
Yes. Yes.
Okay, I did hear you. Thank you, Martha. George Garcia. No, George. Rita.
Yes.
Karen Spear.
Yes.
Kathleen Davis.
Yes.
Val Moore.
Yes.
Katie Jarl.
Yes.
Susan Belden. Susan? I can see you. I can't hear you.
Yes.
Ah, there you are. And Sally Scott.
Yes.
Thank you. All right. 1, 2, 5, 6, 7, 8. 8 yeses, 0 no's. Motion passes. Okay. Rita, the floor is yours.
Okay, well, having heard all the items on the agenda, the time is 8:22. Do I have a motion to adjourn the meeting?
I make a motion, Karen Spear, I make a motion to adjourn the meeting.
Is there a second?
I'll second it. Katie Jarl.
All those in favor, say aye. Any opposed, say nay.
Hold on.
Aye.
How are you going to do that?
Yeah, I'm gonna. Alma, can we just do a?
You can just say aye, or you can adjourn.
Thank you, Alma.
Okay, good. Thanks, Alma.
All right, Rita, try that again.
All right.
Okay,
Hi, Elma and everyone. Okay.
so all those in favor, say aye.
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 All those opposed? Nobody's opposed. Okay, so the ayes have it and the meeting's adjourned. Thank you. It was so wonderful seeing you all. I miss you all, and we will be together soon again.
Thank
All right.
Thank you, everybody.
Good seeing you all. Stay safe.
Good night, guys.
Bye.